Good morning, and welcome to the first UK Telehealthcare webinar of 2026 as part of the Andron Holding Group. You're very welcome today to this event. Just a few housekeeping issues before we move into the event. So the event will be recorded and available on the website. So if your team or colleagues would like to see a recording of that, that'll be available, and you'll be able to access that through the website as well as on YouTube. If you want to raise any questions to our presenters today, you can do that through the chat, and I would ask you to switch your chat to everyone rather than just panelists, so you can share your questions with all the delegates, which makes it for a much more interactive session. I should introduce myself for those of you I haven't met. I'm Jerry Allmark. I've been in the tech sector now for over 25 years as a provider, commissioner, and on the supply sector. And for the last 12 years, I have been the owner and managing director of UK Telehealthcare since prior to its acquisition by Andron Holding Groups in April this year. So we have a very interesting set of speakers today from across the board, looking at a number of issues. But before we move into that, I'd like to introduce you to our new executive CEO, Ross Barry. Thank you, Ross.
Thanks, Jerry. Thanks very much. Yeah, pleased to virtually meet everybody. Some people, some of the panelists we've met, some if we haven't, and I'm sure there's some in the audience that we've met as well. But again, it's good to reach out. I'd just like to say, first of all, thanks to Jerry for the support that he's given us over the past 3 months for this transition to make it as smooth as possible. Uh, that I can't thank Jerry enough for that. We've still got Jerry for another 3 months as an ambassador kind of role, so he'll still be there to reach out and support and help in any way. But we are looking to transition from Jerry over to us so that we're managing everything so that Jerry can toddle off down the beach in the summer to enjoy a bit of this glorious weather and enjoy his retirement. So again, Jerry, thanks very much for the past 3 or 4 months that you've supported us with this.
Thanks, Ross. So today we're looking at something really looking forward more than anything else. So how looking at keeping people at home supported by technology. Now, we've been doing this properly for over 50 years now, but that has grown. And with the movement from analog to digital, it gives us a much, much wider scope of what we can do, looking at preventative and proactive processes, and much, much more joined up through health, social care and housing, as well as technology services as well. So we shouldn't really see the 27th of January 27 as something just technical in a switch from analog to digital. What we should be seeing it as an opportunity for us to move forward, not only to, well, definitely to increase the quality of care through these new services, but also to widen the scope. We've talked about how many people we've had on these services over the years, and it's always stuck around just under the 3 million mark. There are many, many more people that can benefit from the services of being supported at home, and also the benefits to the wider health and care industry, particularly acute care, where we see the issues around hospitals, particularly over the winter months and the winter pressures. So given that, we've invited along a number of speakers today who will be speaking from various aspects of monitoring people and supporting them in their own homes. So our first organisation has been part of this sector from the beginning, really, one of the original organisations. So, and I've been involved with Tunstall again since my start in tech, as when we used their monitoring platforms and a lot of their equipment, and saw in 2005 the introduction of many of the sensors we now take for granted in the homes. So it's interesting both to see Tunstall presenting today, moving forward, but also Shantelle Millian Lawson presenting for Tunstall, who doesn't just come from a tech background, but from a wider health and care background. So seeing a fully rounded picture. So thank you very much, Shantelle. I'd like to hand over to you.
Thank you very much. And by the wizardry that as is, there we go, and it appears. Thank you very much. And thank you for the introduction and for the invite. It's very good to be here. For those that haven't met me, my name is Shantelle and I'm the head of Tunstall 365. Tunstall 365 is our direct to consumer offer within Tunstall, which is launching very soon. We are a very small industry, so we might have crossed paths. And if you're thinking that's a familiar name or familiar face, I previously led the Adult Social Care Tech Fund in the Department of Health and Social Care, before more recently being the Chief Operating Officer of the TSA. Before all of that, way back when, many years ago, I was a care assistant for about 8 years. And so that frontline experience sort of drives everything that I do today and every decision that I make. As Jerry touched on, Tunstall has been here since the birth of our industry. We celebrate our 70th birthday next year, and we're really proud to still design, manufacture, supply. You can see cash there in the image. All of those technologies. We also have an alarm receiving centre, our own engineers that will go out, install and maintain all of our devices and other people's devices. So we really have that full end-to-end understanding of how the systems operate. Today, you're going to learn a lot from a lot of speakers. You've got a lot to digest and a lot to take in. So I'm going to focus on two key areas. I'm going to look at the technology and then I'm going to look at people. And within those two areas, hopefully I'll give you some nuggets of information, my own learnings from not just in this role, but in previous as well, that hopefully you could take away into your day-to-day as you're making decisions for the right technologies to support people. If I could get the next slide. So the first thing I would say is more recently in our industry, we talk a lot about the fact that it's not about the technology. It's not about the technology. It's about the services that wrap around the technology. It's about the support that the technology enables. And in my opinion, that is true to an extent, but I would sort of change that slightly to say, in reality, it's not about the device. It absolutely is about the technology, but it shouldn't be about the device. And that was always one of the challenges when I was in the Department of Health and Social Care. It was really, really difficult to scale nationally and not be focused on the device. And one of the real successes that we had in the Department of Health and Social Care was the introduction of digital social care records. And we saw that nationally scale one particular technology, but we always knew the challenge with that would be the balance in that that's great for that particular technology because anybody in receipt of adult social care needs a care plan. But beyond that, the technology should be very specific to what the individual wants and what the individual needs. And we still need to be able to make technology choices that enable all of that to happen. And that's a really, really fine balance. So what I would say is when we're thinking about the technologies that we're purchasing, thinking about the right infrastructure and all of that stuff that people don't see and that the user using the technology doesn't see. But they're the things that are really, really important. And what's been great for me to see after leaving the department is that they're now starting to step into the space of thinking about standards and thinking about their work with others to sort of set that evidence standards framework. That's been a long time coming, but I think it's great to see that they're sort of recognizing that position in the market and where they can really support. Next slide. So then moving on from a technology perspective, the bit that's really important to us all is the people perspective. And as I said before, from our perspective in Tunstall, the device should be really centred around what it is that the individual wants. And again, in the Department of Health and Social Care, we tried this with the Adult Social Care Tech Fund, but again, it was personalised to the area. It wasn't personalised to the individual themselves. And to give a little bit of flavour to this, my husband's nan is 90. I'm the head of Tunstall 365, and I could not convince her to use Telecare because in her mind it's for old people. But she loves Alexa. She loves Amazon Alexas and the show. She loves TikTok. She loves all things around social media. And she will use, if she needs help and she gets stuck, she will use her Amazon Alexa to call somebody in the family for help. And apologies to anybody who's listening who Alexas I've just set off with that word. So apologies. But she didn't see that she's using technology to support her to live her most independent, best life that she possibly can. And when she decided 36 hours ago that actually she might need a little bit of help, within 24 hours of that decision, she's actually moved in and living now with myself and my husband because she made the decision and recognized that she needed telecare at a point where it was really too late because in her mind it's a stigma and it's a technology that is in her mind for old people. So that's a real challenge that we need to overcome is how do we help people recognize that, but also how do we enable people to use the technologies that are really right for them. And so for us in Tunstall, we recognise that the technologies that support somebody shouldn't stop at the four walls of their home. And we are very much talking this morning about how we support people to stay in their own homes. But for us, that support should be beyond the home because what we don't want to do is inadvertently put barriers up to somebody then realising that actually this support, this comfort that I've got at home of technology stops at the garden path. And that's not what we want. We want to be able to enable a full wraparound service of support. But for us to do that, we need the right platform to enable that to happen. So next slide, please. And so for us in Tunstall, to make that happen, many of you will have probably heard of ILOS, which is coming soon. This is sort of our equivalent, I would probably say, to the social care interoperability platform that many of you have seen is in development with NHS England and DHSC. And that's because they recognise that regardless of all of the technologies that we funded in my time, before my time there and beyond, they've recognised that actually it's about the interoperability of devices. And so ILOS I would consider is sort of our equivalent operating system to enable the fact that it then doesn't matter what technology somebody chooses to use in their own home. And I'll finish with a little snippet, a little teaser of what's to come for Tunstall 365 and what the future looks like. This is a video. We are all virtual, so who knows what might happen. But if you could try for me, please, onto the next slide. And of course, there's no audio. She is saying hello. She is saying, I'm Alexa. I'm here to support. Unfortunately, there's no video with it. There's no audio with it, but it gives you a little bit of a flavour of what's to come for Tunstall 365. We're very excited to be working with partners such as this one to enable a person to choose the technology that they want to choose in their home that then has the support and the alarm receiving centre and all of the other support that somebody needs that wraps around the technology. So again, thank you for your time. You've got lots to digest over the course of the next few speakers, but if you want to hear more, if I can give you any advice, support, either based on my background or my time in Tunstall, then please get in touch. And Jerry, thank you.
Thank you very much, Shantelle. And we'll see you later on the panel. Okay. So our next presenters are from TakingCare. TakingCare are probably one of the larger of the private monitoring centres in the UK. And interestingly, I think Shantelle touched on this, is I think TakingCare is one of the first monitoring organisations that have been of real interest to me, that have taken us very much from people receiving monitoring from local authorities only, but also providing monitoring on a B2C basis. So very much a different model for the UK, which is fantastic. So I'd like to find out much more about that. I'm sure you all would, from Sarah O'Callaghan. Thank you, Sarah.
Thank you so much, Jerry. Good morning, everyone. I'm Sarah O'Callaghan, for those that don't know me from TakingCare. And today, thank you for inviting me along. I wanted to introduce Autumn, which is our new preventative wellbeing service that the idea is to help people stay active, confident and independent for longer. I hope to briefly in my 10 minutes cover why prevention matters, how Autumn works, and also what we're developing through partnership. So next slide, please. So as many of us know, across health and social care, we're facing a perfect storm: an aging population, rising demand, workforce pressures, and increasing costs. And at the same time, most of the support is still triggered by a hospital admission, or an escalation in need. So the question really should be no longer why prevention matters, but how we can deliver it at scale across the UK. So I've put some stats on the screen, so I'm not going to share those out, but just for, to really bring it home really why, there is definitely a case for prevention. Next slide, please. One of the biggest challenges facing health and care services today is that we don't often see decline until it already becomes a crisis. And if I can just all ask you to think about an older person who is living independently at home. 6 months ago, they were walking every day, seeing friends, doing shopping and managing well. Then gradually things begin to change. They walk a little less, they spend more time sitting down, they lose confidence going out. Perhaps they stop attending the activities they enjoy. None of these changes trigger a referral, none of them create an alert, and often nobody notices. The system typically responds when there is a hospital admission or a request in additional support. But decline didn't start at crisis point. Decline started months, often years earlier. And that, I believe, is the prevention gap. The opportunity is simply not responding faster to when crisis happens. I really believe opportunity is identifying meaningful change early enough that we can still do something about. 1 in 3 adults over age 65 experience a fall every year. The reality is that most falls don't come out of nowhere. Most falls often associated with gradual changes in activity, mobility, and confidence. So the question should become, how can we identify those changes earlier, before confidence is lost, before support needs escalate? And that is where Autumn comes in. Next slide, please. So I'm really pleased to introduce Autumn. Autumn is our personalised activity and wellbeing service that is designed to help people stay active, confident and in control of their own lives. It learns what's normal for each of the individuals and gently keeps a watchful eye on their daily activity and routine. Alongside the technology, Autumn promotes mobility, strength and healthy habits through simple exercises, wellbeing guidance and encouragement. This is important because declines in strength, balance, and activity are often early indicators of reduced confidence, increased falls risk, and loss independence. And we believe by helping people stay active and identifying meaningful change early, we can create opportunities to intervene before a hospital admission, a fall, or escalation in need occurs. It's really important to state that this isn't a medical device and it's not an alarm. Autumn sits before crisis, helping people maintain their routine, confidence, and independence for longer. Next slide, please. And to bring it to life and to make it easy to access and engaging from the start, participants receive a simple wellbeing kit. And as you can see on the screen, at the heart of the service is an activity tracker, which in this picture and what we use is a Fitbit Inspire Free, which helps understand each person's normal activity patterns and identifies meaningful change over time. It's also supported with practical resources, including exercise bands, movement guides, and wellbeing information focusing on healthy habits, mobility, and strength. And we also include a hydration bottle, which also helps reinforce simple daily routines within and personal wellbeing. The aim is not just to monitor activity, but it's to give people the simple tools and encouragement and support to keep them moving and to build their confidence. Next slide, please. Autumn looks for change in several ways. Firstly, it looks at the daily signal, analysing activity from the previous day, and this really helps us identify the sudden changes that may be important but simply not reflect a quieter than usual day. Secondly, we then look at a rolling 2-week trend. This helps us smooth out the normal day-to-day variation and helps distinguish from a one-off dip to a general change in routine. And by combining daily activities and rolling trends, Autumn builds a clearer picture of meaningful change. This is a key point that Autumn is not reacting to one single step count. It's looking at patterns over time so support can be offered at the right level at the right time. Next slide, please. And I've tried to bring in this slide how Autumn works in 4 simple steps. First, Autumn spends 14 days learning what is normal for each person. That means we're not comparing them, we're comparing them to their own routine and not to anybody else's. Then it encourages healthy habits through light touch support, practical resources, and strength-based movements. It then also looks for meaningful changes in activity and suggests confident mobility and well-being is starting to shift. And finally, when someone needs a little bit more support, Autumn can offer guidance, encouragement, or connect them to agreed local services. And I believe the best way to describe Autumn is that it's like a gentle well-being coach. It quietly is in the background, helping people maintain their routine and just keeping a watchful eye on them before these sudden little changes creeping over time. Next slide, please. So once Autumn has got to know what normal looks like for someone, it doesn't jump on every little change. As we all have quieter days, some of us move less because of bad weather, feeling tired, or even, for those that are watching the World Cup, watching all the World Cup games going on at the minute. But this doesn't necessarily mean it's a problem. So what we do is look at one-off dips compared to a general shift in routine, and in turn, we turn that into simple statuses so everyone can quickly understand what level of support is needed. Thrive means that routine is maintained. They're doing a good job. They're on track, and they're keeping on top of their mobility and their confidence. Adjust means that early change has been detected, which is normally an early short-term change. Restore means that sustained change where extra support is required to rebuild momentum. And protect is the most significant or sudden change, with a faster check-in may be needed. And within protect, this is likely that a person is likely to have a fall within 10 days. So autumn shows whether someone is improving, stabling, or worsening, which gives us their current position and their direction of travel. The response is always proportionate. Most people will receive a light touch encouragement and motivation to help routine and independence. Meaningful change is identified, and when Autumn can then prompt signposted into agreed escalation local pathways. It's really important to say Autumn does not create new pathways. We simply agree signposting and escalation routes with each partner in advance using existing local services, support networks, and prevention pathways. Next slide, please. When someone has moved through the statuses and in restore or protect statuses, we then apply what we call our autumn framework. And this helps us have a non-clinical conversation to understand what is going on, what is, and ask questions in relation to what's impacting that person, so we can then signpost the relevant services. We look at 6 areas. We look at aging and mobility. We look at underlying changes, treatment and therapies, unsteadiness, mood and mind, and nutrition and hydration. So in the example of this, it could be someone's suffering a family bereavement, or they're up in the night several times, which could indicate a UTI. So having this two-way conversation with a person to unpick what is changing in that person's life, which meant that their mobility and their steps and their sleep has changed, we will then take action and signpost them to the relevant services. So we believe that the autumn framework is a holistic way for us to connect the right support at the right time. Next slide, please. And now I've sort of explained how autumn worked, and I hope it sort of makes sense to those on the call. But I wanted to really bring it to life with a real example, which we're currently being developed. And this is a pilot is sort of demonstrates how Autumn is designed to complement and enhance existing services rather than replace them. And we are currently working with Somerset Council in relation to the Move to Independence Plus, which is in its final stages of development and should be launched later this year. And the pilot is a one-year proof of concept, bringing together Somerset Council, Somerset Activity and Sports Partnership, and TakingCare to test how reconditioning, prevention, and digital monitoring can work together to support independence. Somerset Independent Living Centres would identify the participants through their existing assessment process. And then Somerset Activity and Sports Partnership then deliver the Move to Independence intervention, which is about providing people coming out of hospital with physio support to try and rebuild their mobility and strength. And then Autumn provides the digital layer, which is then establishing that baseline and allowing that person to be supported after the 6 weeks that they have through this Somerset Activity and Sports Partnership, helping people maintain momentum and reducing the risk of decline once normal intervention has been finished. What makes this pilot particularly interesting is that it's combining human support with digital insight, which is allowing the partners, us and the resources to actually be able to provide real evidence to whether a joined up prevention model can improve quality of life, reduce risk of falls and prevent escalation into health and social care. And for us, that's exactly what Autumn was designed to do. And so this pilot is still in development, but I really wanted to share it with you today because it's showing how each organisation to come together to come up with a common goal and hopefully secure investment for prevention for the future. So I hope to come back to you in a year's time to say what we've learned, what the impact has had, and how this kind of partnership model can support prevention at scale. So that's something that's really dear to my heart, and I really believe that together we know we can change the way that we deliver care in this and tech into this industry. So thank you. That's it from me. I think I hope I've been in my 10 minutes. I have a habit of rattling on. So thank you for your time, and I'll now hand back to Jerry.
Thank you very much, Sarah. Really, really good examples, I think, of looking at how we look at preventative and proactive services going forward, but also joining up patient records and information with other services as well. So thank you very much for that. I'm sure we'll come back with some questions for you on the panel session when we see you later. Thank you.
Gary, sorry, just to come in, I see that there's a couple of hands up in the audience that perhaps have got questions for Sarah. If we could do them just now, perhaps. Saria, sorry, apologies for the name. Saria Kliski, you've got your hand up.
I'm not sure whether Rebecca has set up the delegates to be able to use the audio. So I was going to message them to ask them to put them on the chat. I think that might be the issue, Ross.
Okay, that's fine. That's cool. That's cool. Learning curve, as we say, it's a learning curve today for us.
So yeah, I'll just remind delegates, if you have a question, if you'd like to put it on the chat, I will try and cover those questions to the relevant presenters during the panel session. So I see, Nikki, you also have your hand up as well. So if you can put that in the chat, thank you. Okay, so our next presentation is interesting because it's not looking at monitoring per se, but using tech in a different way, using the technology in a very different way to support people in terms of independence, in terms of information, and also to support the health service by providing the right information so that people can support themselves rather than rather than presenting at acute care and emergency departments um, as a first stop. So I'd like to ask Nicola Murgatroyd to join us, and Nicola will be talking about an app that Kuradocs have developed that will very much address these issues. Thank you, Nicola.
Well, thank you, Jerry and Ross. And, this is a very interesting session already. So it's been lovely to hear the other two speakers, and I'm looking forward to hearing the others as well. My name is Nicola Murgatroyd. I'm CEO of a company called Kuradocs Limited. And at Kuradocs, we research, we build, and we market digital products that support patients and carers with primarily hospital discharge, but staying well at home so that we prevent readmission as much as possible. A bit about my background, because our company is very much driven by passion. Next slide, please, Rebecca. Rachel, sorry. Thank you. The whole team is very passionate, and I myself, although my life has been spent in business, was a parent carer for 28 years to my daughter who had complex special needs. And that passion is threaded throughout our team. As with most people, at some point in our lives, we've experienced caring for a loved one. Mine was with my daughter, but also for my parents and parents-in-law as they got older. And that passion we've married with knowledge and business focus, and our mission is to help, as I said, patients and carers. Next slide, please. During our research, we found that every day more than 13,000 patients stay in hospital longer than they need to. And this is a problem at the top of every NHS trust's to-do list. And a recent health services report has showed that these delayed discharges are costing the NHS a staggering £2 billion a year. And to add to this, the population, as I suspect everybody on this call already knows, is set to double by 2050. Hospital discharge is not just a clinical decision. It's a handover to real life, to families, to paid and unpaid carers, to community services. And when that handover is unclear, quality drops, and patients and families leave without confidence or don't leave at all for days. And staff are spending time repeating information and firefighting confusion. Ultimately, discharges are extended, patients stay longer, costs rise, beds are locked, and waiting lists continue to increase. Next slide, please. And this is where Myra comes in. Myra is built in direct partnership with University Hospital Southampton NHS Foundation Trust. It's powered by each trust's own knowledge base. Pathways and local services are also in the app. So the guidance is not generic. It reflects how discharge actually works in that system. Who to contact, what questions to ask, what happens next, and what support exists locally. Myra is already in the hands of real patients, and the foundation for the app has been proven. Instead of leaving quality to chance, the trust can give every patient and family the same clear, consistent, trusted guidance right when they're most likely to feel overwhelmed. Our research showed over and over again that people do feel overwhelmed. They feel stressed and they feel confused And I've been in carers' lounges myself, and where the calls have come in, not carers' lounges, at carers' support services, and heard the people in tears on the other end of the phone. People do not know which way to turn. And I just want to add a bit in here, and that is that it resounded with me when Shantelle said that tech doesn't change lives, it supports lives. And all the tech that's become available in recent years and is becoming more of it's becoming available all the time is, of course, fantastic. But in some ways, it adds to the confusion for people. And information is absolutely key. But information is only useful when it's explained in an accurate and accessible way that can be used so people can action it. And I can see a thread already through our conversation today about this. The Myra app takes information and surfaces it to the person in a clear and understood and accurate way. Next slide, please. We work Myra as the app, and also alongside and connected is the website platform. There is a global knowledge layer which contains national NHS information and national information about products and services to help those products and services that help people remain well once they're discharged, in order, of course, to prevent readmission. And there's a regional trust level, which is unique to each area of the trust and area where the patients live, so they can find clearly that local support. Next slide, please. Both are connected. And as I've already said, they offer clear guidance through the discharge process and guidance to products and services, which are curated. We curate our products and services, so these can be understood by people, and so they know clearly what there can be to support them at the time that they need that support, and also the family carers and the other carers around that person can too. Next slide, please. The result is that patients and carers feel supported. We know this from the work we're doing within UHS. They know what questions to ask, which makes it easier for staff and product suppliers. Staff have the ability to easily expedite discharge without compromising on care. And hospitals gain more bed capacity and are reducing waiting lists. And NHS trusts are able to save millions in costs and lost funding. The simple design and our ongoing partnership with UHS Southampton ensures the avoidance of most of the pitfalls of NHS implementation. So I think it's going to be an interesting discussion afterwards, because, as I've said already, it's wonderful to have all the support for people. What we're doing with Myra is providing a medium through which we can clearly and easily explain to patients and carers and staff the benefits of a lot of the technology there is available to help them stay well at home. Thank you.
Yes. Thank you, Nicola. That was very insightful. And again, I think this kind of leads into a wider conversation around care and how it's been delivered. That's maybe for another day. But yeah, I mean, I can see the benefits of a platform like this for the NHS and hospital discharge, and just speeding up the whole process. So, Jerry, have you got any comments?
I think, as I said earlier, it takes a different approach, which I think is very innovative, really, to the prevention side by actually providing the right information, which is really important. I recently spent a few days in hospital having knee surgery, and it was quite, for someone like myself who works within the sector, you can see the hurdles that you need to cross, especially when you're looking at discharge and how what the facilities are as the options are around that. So having that information available, I think, is incredibly valuable for everyone. And so thank you for that, Nicola.
Yeah, again, there is a question come up from Helen Davies in the chat, Jerry, saying, is this currently only available for specific areas, counties? So I think it'd be quite apt if Nicola could answer that just now rather than get lost in in the conversation.
Sorry, Ross, do you want me to answer that now?
If you could,
Yeah.
if you could.
Yes, we actually would really appreciate as many people. I didn't say in my presentation, the Myra Hospital Discharge app is free and it collects no data. It's very, very easy to download from the app stores because we've made it as simple as possible. It is useful to anybody in any area because of the national level information, which we're building all the time. Local area, we're focusing at the present time on South Hampshire, but if more people download the app, we can get more funding and we can roll it out to other areas quicker. So, if everybody on the call could get their phones and go to the website, which is myra.co.uk, and download the app, that would be a great help, and they will find it useful. I was in University Hospital Southampton last Friday, where we were working with a lot of staff there, and some of the staff there had relatives within the hospital itself, and they had a relative elsewhere, and they were downloading the app so it could support them with their relatives' discharge and then staying well at home. But also, if any companies want to talk to us about being a partner, as I say, we curate our partners, but I'm sure, on the call, we'd be very happy to take inquiries or from social care or NHS as well.
Yeah, thanks, Nicola. Appreciate that. Thank you.
Thank you very much. So we'll move on to our next presentation. Our next organisation is Kyndi, and I'd like to hand over to Robert Kennedy, who's the head of sales and business development there. Thank you, Robert.
Thanks, Jerry. And thanks everyone for having me. You're lucky enough not to get a PowerPoint presentation from me today, so you're just going to have to look at my ugly mug and just go through why Kyndi are different. So we come at it from a slightly different perspective than the rest of the guys here. Kyndi are a local authority trading company operating out of Kent, primarily supporting Medway Unitary Authority and Medway Council. And because of that, we sit outside of the general way that councils operate their telecare and assistive technology. We're in a position that we're able to make agile decisions. We can react quickly and take in on new products. We control the process from assessment to ongoing reviews. We sit within the social care department at Medway, and we also sit within the acute trust in their discharge corridor. So we can support with clients on a really quick, fast basis. We can go to bedside, we can discuss, we can carry out assessments there, we can discuss with family members challenges and needs. And because of that, we sit in a quite unique position supporting Medway and Kent. We've got our own 24/7 ARC, which handles both reactive and preventative alerts across some of the new products that we've successfully launched over the last couple of years. Because of the way we do things, we're interoperable with multiple devices and systems, and we obtain holistic data from all sources to report back to the relevant people, whether that be family or whether that be our adult social care colleagues or our community colleagues. And how we deliver this is through our care technologists. Now, we are one of the first organisations to roll out care technologists. We were part of the NCF's think tank that created the course and the curriculum for it. So we currently have 7 care technologists working in the community, working at the acute trust and within adult social care. And these 7 individuals, their main function in life at work is to enable safer, independent lives through person-centered support in the right environment, which is why we're here today to talk about. They carry out person-centered assessments. So the care technologists conduct tailored assessments focusing on individuals' goals, routines, and preferences to ensure meaningful technology use, and whether as we've heard today, whether that is existing tech, whether someone's got a Ring doorbell or someone's got an Alexa, and how that can be repurposed to support right up to challenges that will be overcome by medication dispensing robots or smart light bulbs. One of the roles of the care technologists and what they do really well is they build trust and accessibility. So they liaise from beginning to end with clients and families. They explain the benefits of the technologies, how it overcomes the challenges that the individuals are having, and by doing this, they also address the digital exclusion to build trust and in confidence across the board. As I mentioned before, the coordinated holistic support enables us to bring support in from the voluntary sector. It enables us to collaborate with the care teams with our findings and to signpost to services. And we can then integrate the technology that we assess for into the broader care plans, both within the acute environment and then out through an enablement pathway and then onto a long-term platform, whether it is funded by adult social care, whether it's funded by the family. We have the ability to do both. And then finally, what we offer is data-driven safety monitoring. So we analyze behavioral data and alerts to identify risks early on and support with timely interventions, because we know that at this point of time, technology may work to overcome a challenge, but people are on a journey and then they will need early intervention if we can, and much like the autumn solution that we heard about earlier. So as I said, we're able to use assistive technology. We're able to use traditional assistive technology, which still has a place, and we use our prevention technologies, whether it is to do with activities of daily living or whether it is the piece to support with better sleep patterns. And we've learned over the last couple of years that by carrying this out, we're able to support the NHS prevention agenda. We can provide that early identification and monitoring, which will enable us to reduce avoidable hospital admissions. We can empower the self-management. So some of the assistive tech that we put out, such as the medication devices, enable individuals to manage their medication better. It's theirs. They are independent with their medication. They're not relying on carers coming in. We can signpost to health apps and mobility aids and communication tools. And this in turn reduces pressure on services, it improves safety, reduces crisis, and supports community-based care. Our integration platform enables us to support the ICS and the ICB priorities. And our reporting will also support our colleagues in both social care and health. Overall, what it does is it creates and improve independence and quality of life for the individuals. People are in the right place at the right time. They are agile enough to be able to move if they want to move to different areas to continue that support. And the main thing is to avoid these crisis admissions into hospital and the crisis presentations to social care. So just a few products that we've successfully launched. So we've launched a medication adherence device called Evondos. We've currently got just shy of 100 units across Kent and Medway. we've launched the circadian smart light bulb, which we've got circa 180 patients and clients being supported with some great outcomes on both of those. We're running the 2IC care Andy device along with their activities of daily living and their non-wearable falls detection. We are currently looking at standalone devices such as the Beach Band to support Parkinson's and with regard to children's sections, some forms of autism. And we are one of the supporting members of the Alzheimer's Innovation Trust. So we've just taken on board the Smart Sock solution. So the idea is that if someone comes to us and presents with a challenge, or they're on a ward and they present with a challenge, if the technology isn't readily available, we won't try and make the existing technology fit. We will go out and we will try and source a technology that can support them. And if that's not readily available, we'll speak to our partners and our suppliers and see whether they can tweak that support. So yeah, that's just a little bit about Kyndi. It's like I say, a little bit different from the rest of the guys, but that's what we do as our managed service. So thank you very much for listening, and sorry about the me and my ugly mug.
Robert, thank you very much. Interesting on the fact that you have so many interoperable systems working across your services, which is brilliant, and looking at those sort of proactive and predictive services as well. Just one question really around, you talked about supporting the Kent and Medway areas. Do you work outside that at all, or are you purely restricted to that geography at the moment?
We're relatively restricted by geography, but we're looking at supporting with the Evanders partners in a different area, and it's just at the position with regard to the managed service. It just requires us passporting individuals or taking on individuals, but the service will be the same. So yeah, we're looking to move geographically outside of the southeast.
Brilliant. Thank you very much. We'll see you later on the panel. Okay, so our next organisation presenting is Mole Valley Life. We're just crossing the border from Kent to Surrey, and I'd like to introduce you to Stuart Cole, who will be presenting. Thank you, Stuart.
Thanks, Jerry. Good morning, everybody. Yeah, my name is Stuart Cole. I'm the service lead at Mole Valley Life. And it's really interesting to be invited along today and to hear so many, as you say, different presentations where we're all really trying to achieve that same primary objective of keeping people in their own home where they choose to live. I'm here today to update sort of operationally really on some of the work that we've undertaken in partnership with Surrey County Council and our NHS in the Surrey area, because this is one of our most significant shifts really as we move from analog to digital. And I'm going to focus on a couple of bits operationally that we've been utilising over the last 3 years. Next slide, please. I think, looking at our operational, we've done a lot of co-production with our service users and understanding where their concerns are. And the 5 along there tend to be the top points that are raised with us, the cost of care, looking at either sort of living care or residential care. If an ambulance attends, our residents are concerned about that might mean a trip to urgent and integrated care, the hospital discharge process. Falls and loneliness tend to be very high on people's concerns. And then there's also where families are really want that reassurance that the mum and dad are sort of safe and well in their home. Alongside that, we've got a couple of really key operational risks that we're going through at the moment, our transition and migration from analog to digital. And then in Surrey as well, we're going through local government reorganisation. And on the 1st of April, we will be transforming from 11 district and boroughs and 1 county into 2 unitary operations. So there is a significant amount of change that we are going through at the moment. And as Mole Valley Life, we are a fully integrated and managed service across 5 of those district and borough services. And we've been operationally for about 40 years now. And as I say, for the last 5 years, we've started to take on a more proactive and preventative approach of our technology that really allows us to really focus on that community support, transitioning from analog to digital, and being much more preventative in our work. Next slide, please. So as we look at our new model of care that we've developed, as I say, in partnership with Surrey, our connected care is really starting to reach out into different forms, using motion sensors that manage light, temperature, and movement, that allow us to build a picture of somebody's activities of daily living. We also then can complement that with virtual care, so we can bring in virtual check-in reminders, maybe for medication or for meals, or just to remind them that it's an important appointment that they've got coming up. All of this is using a dashboard. We're currently using Cascade, and that comes with a family carer access as well. So it really offers another level of reassurance. And I'm trying to use some real life stories, and the data that you can see on the screen there was Mary's. And Mary had been referred to the service from hospital discharge just to assess how her activities of daily living were. And generally there was a pattern of standard movement. She was low risk, so there was no additional care technology put into the home. What we noticed suddenly over a 3-day period was an escalation point that ended up in a crisis. So actually the door openings were quite standard, would generally open at the end of the day, maybe in the start of the morning. But over a period of time, over 3 days, there was an increase in those door openings. This was picked up by an alert into our proactive team. And actually on the 3rd day, the alert increased because there was a 5-minute period that the door was open. Our wellbeing coordinators picked up that alert. This was at 2 o'clock in the morning, and unable to contact the home. There was a period of inactivity, so we had a concern that the resident with Mary was no longer at home. We contacted the police, who made a welfare check, and on arriving at the property, they found the door was wide open. But on investigation in the home, Mary was sat in the lounge, perfectly safe. But the police were able to make contact and then secure the property. Actually, having this bit of information allowed us to escalate that referral to a more reactive form of technology support, but actually reassess Mary's needs at night as well. Next slide, please. So using data in this way really allows us to make much richer and more evidence-based decision making. And that works in 2 ways that we found over the last few years. One is that it means that we're not under provisioning care for somebody, maybe leaving them at risk, but also that we're not over provisioning care, which can end up being sort of debilitating to the residents. And here's 2 cases with 2 very different outcomes that evidence that. So we had Vera. Vera's family were concerned. She was living with Alzheimer's and vascular dementia. They were concerned that she wasn't able to support herself in home. So actually placing these sensors in and around the home, we were able to look at those activities of daily living and really understand that actually in Vera's case, there was a consistent movement day and night, which was really demonstrating that there was a poor sleep pattern. The kitchen appliances were being used through the night time, and although when the care visits during the day, she was not eating that well, and the front door was opening as well. So actually being able to take all of that data and remove emotion from the decision, they were able to objectively review and actually determine that the best support for Vera was to place her in residential care, where she could have a more structured routine into her living. And then we had Dorothy, and Dorothy, again, the family were concerned. She was under a potential diagnosis of dementia. And the family were concerned that she wasn't able to support herself at home. Installing the connected care along with a QDS package really evidenced that actually there was a settled pattern of activities. The kitchen appliances were used by the care provider and not outside of the expected times. There was a very routine and standardized behavior in the home. Trips to the bathroom were standard, and minimal activity at night. So what that actually evidenced to the family that Dorothy was able to support herself, and we were able to keep the resident at home, but also reduce that package of care to 3 visits a day. Next slide, please. So really using data in this way allows us to think of the art of the possible, and how can we really utilize our remote monitoring hub to ensure a reduced impact on the resident. This then can allow our clinical teams to really focus on those more complex and higher needs, be more preventative, and actually create a more sustainable service where our residents are at home living again where they choose, and keeping that primary care relationship for longer. Next slide, please. And one service, and I think for us, this is always very much where technology complements service, was our community wellbeing responder service, where we'd identified through the data that we believed we could offer a non-clinical social service that would respond to non-injury falls and maybe cause for concerns where we were previously escalating to the ambulance service. By doing this and having this rapid response service, we've been able to develop that over the last few years, so that initially where it was very much targeted at sort of reactive pendant lifeline alarm presses, we can now actually receive clinical pathway triage from 999 or 111. And actually that's further developing into professional referrals as well. You can directly refer into our service. As we've developed further, we've also actually been able to build partnerships with our urgent community response teams, so that if we are attending someone for a non-injury fall and we have a concern, we're actually able to refer into those services as well. And it works out, I think, over the last year, about 1 in 4 that actually we are giving an onward referral, as well as being able to deal with that initial sort of crisis point. So some stats there you can see on the slide. Last year we attended just under 2,500 incidents. 91% of those, so 9 in 10, are resolved without that escalation to 999. And we're really able to effectively prevent that long line deterioration, because our average response is just 25 minutes. We're also to really evidence that there's a healthy return on investment for this. So £4.09 for every £1 spent on the service. But I think there's a wider wellbeing effect of our service. And if we can go to the next slide. So I'd just like to finish on a story. We focused on long-term support, but really on Charlie's story, which is focused on maybe a short-term support. So Charlie's story, he was fiercely independent, living in his 90s, and he really wanted to spend his final few days at home. So he self-discharged himself from hospital on a Friday afternoon. The adult social care team referred Charlie to our service for a pendant alarm to keep him safe over the weekend, and our community wellbeing responders were actually able to attend and install that in the Friday evening. Over the course of the next 8 days, we attended Charlie's property 10 times. We were able to be a real key link for Charlie between social services, but also Charlie's family, who lived far away. The service was able to reset his trip switch after a power cut, reset his mobile phone so he could make contact with his family. We were actually also able to attend following a couple of family phone calls where they had some concerns about Charlie at home as well, and just really kind of offer that level of reassurance. Charlie had capacity. He had a desire and his wish to stay at home in his final days. And by having a wraparound service with technology, with our wider care support, we were able to really honour Charlie's final wishes. Next slide, please. So in conclusion, we feel very strongly that technology, as we've heard already, is a complement to wider care support. Being able to offer a virtual element alongside a physical element of care really enables people to live independently, give them the ability to raise help, or have technology that can identify changes in patterns, and really ensure that patients receive the right care at the right time. Thank you.
Thank you very much, Stuart. We've got a couple of minutes, so there's just one question for you that I'll take now then. It's from Rob Stanbridge, and Rob wants to know, how do you do virtual check-ins and reminders? Is this via telephone call or an automated system?
Yeah, so at the moment it's done very much from our proto team with virtual calls, and we're obviously looking at elements of where that can be done with other technology as well.
Brilliant. Thank you very much, Stuart, and we'll see you later in the panel session. So, thank you to all our presenters keep it to time. So we're on to our last presentation now, and that is from one of our long-standing members, Legrand Care, and Cathy Hodgkins will be presenting on their behalf. Thank you, Cathy.
Good morning, Ross, and thank you for the opportunity to share with everyone this morning. Hope you've all got your fans blowing today. It's very warm, so I'll try and make this as brief as possible. My office is actually like a sauna, so I've had to close my doors because there's loads of gardeners outside, so I am cooking in here. So my name is Cathy Hodgkins, and my role at Legrand Care is Senior Business Development Manager. I've been at Legrand Care nearly 7 years now, can you believe it? Prior to which I worked in local authority in an independent living service. So having had that experience of both the ups and downs of providing this service has helped me understand the needs and challenges that we all face. So just a quick intro for those that may be not familiar with Legrand Care on the call today. Legrand Care is a brand specialising in the innovative development of connected solutions for health and social care sectors. We're a global team with a passion to improve people's lives. With over 5 million connected individuals, we handle over 50 million events monthly. Next slide, please. Technical. So at Legrand Care, we tirelessly work so that everyone can live in the environment of their choosing for as long as possible, enjoying independence, peace of mind, safety and well-being. Our technology is designed to create connected homes where all systems are linked to the cloud and offer personalization with intelligent algorithms, real-time monitoring, analyzing daily routines to respond to user needs in an accurate and immediate way. Next slide, please. So the title of this webinar is Relieving the Pressure on the Acute Sector. So let's have a look at what has already been happening and still is. So way back in 2022, one of my customers, Tameside Community Response Service, began a journey to bridge together health and techs into a single support package for their customers. The results were a very successful service that were designed to work around a client, giving them the care that they needed. Their journey was so amazing that I visited them with our marketing team to produce a case study that you can read on our website and watch a video of their journey. Innovation alone does not lead to improved patient care. To affect change and make a real difference, technology requires partners to collaborate around a shared objective, around person-centered outcomes and the ambition to achieve positive change. An excellent example of this approach is being employed with Tameside right now. It truly is a best-in-class example of how various technologies and services can be employed by multiple departments with a single vision and a shared passion to improve the lives of their stakeholders. Tameside Community Response Service brings together community response wardens, a clinical team based in the Digital Health Centre at Tameside and Glossop Hospital, and community pharmacists. They all work together to offer service users the independence to stay within their own homes with control over their own well-being and lifestyle, while also giving peace of mind for families and friends. The community wardens are supplied with Skype-enabled technology that allows them to video conference into the Digital Health Centre so the service user can have a face-to-face consultation without leaving their home. All this is whilst on the call, so it gives a full picture and support in planning the best outcome for the patient. Tameside ethos is right patient care, right provider, timely manner in the right place. Tameside work closely with the hospital discharge team and pharmacies by using the digital pill dispensers, for example, to ensure the correct medication is available as soon as possible without delaying the return back home for hospital discharge. Having the correct medication at the right times can help prevent a fall, so it is vitally important in the patient journey. Tameside have received an iNetwork Innovation Award for their partnership working with digital health and proactively looking for new ways to support their service users. I know back in 2024, their stats was quite high, and they were averaging annually over 3,000 falls that were attended. over 3,000 ambulances that were prevented, and over 4,000 medical prompts delivering medication. And that is removing the need for a 15-minute home care call service. You can see the case study, and you can see from those pictures there, I was in person while we videoed and filmed this gentleman, and it was life-changing for him. Next slide, please. So how can we build on this fantastic service like Tameside moving forward and take advantage of new and upcoming innovation? So Tameside Community Response Service, alongside many other customers, and not only in the UK, but in Europe, have used our cloud management portal, CMP, or we call it Pulse, to support, enhance and transform the service. This is a web-based tool that allows them to remotely monitor, program, configure and manage all the Legrand Care devices, all in one place with one common administration. This has helped improve workflow optimization and service efficiency, alongside substantial cost savings. For another one of my customers, they say that Pulse has become their best work friend and support. Next slide, please. So Pulse CMP includes a business intelligent dashboard that provides better device management through data analysis. It is an advanced data analysis tool that allows you to collate all that information and perform analysis of the data corresponding to all your alarms and your peripheral devices across your whole estate. As we move to a much more proactive and preventative service, we can bring in these AI insights that can highlight the most meaningful data points to help reduce cognitive load. It will not replace decision making, but rather it can support thinking and understanding. Next slide, please. So now I'd like to introduce you to the Novo Go GPS telecare device. This is the next generation of technology that supports independence and safety both inside and outside the home, further reducing the pressure on the acute sector. This technology is part of our ecosystem, and customers can and are already introducing it to their current service and to their cloud management portal. Next slide, please. So Novo Go is a connected device. Can I go next slide again, please? There we go, thank you. So it's a connected device that benefits from all present and future device management functionalities in our IoT platform. Customers are now looking at what else they can do to support the areas where tech historically couldn't reach. And these areas include social isolation support, dementia support, agoraphobia support, acute health risks, and many, many more. I'm sure the presentation will be shared with you today, so I'm not going to labour on each point, but rather just highlight a few key points from those support areas that I just mentioned. Next slide, please. I'll carry on while you're doing that. So dementia support. The Novo Go supports a person living with dementia at whatever stage they are at. Whether this is progressed dementia and requires a Novo Go to be supplied with a dementia lock, geofencing enabled, fall detection enabled, reminders enabled and connected to a hub, to providing reassurance to the family should someone not return home from outside their usual routine. We've got social isolation support, so the Novo Go is fully configurable to suit the person's needs and requirements, as well as the service. Although a GPS request can be made by the service at any point, so you always know where a person is, should you need to, it can also be configured so that service user can decide when their location can be shared. Some people might not want that. So this gives the service user control and choice, thus respecting their wishes. This makes this product suitable for all ages and all abilities, not just for someone who isn't able to make their own decisions. Agoraphobia support. This encourages confidence and gives the service users a lifeline outdoors should they need it. You've got 2 clear-way speech so they can request help and speak to a contact centre operator when dialing a friend or a family member proves difficult for them. We've got acute health risks. An example is a person living with epilepsy that wants to remain independent and carry on their love for cycling. In the event of a fall caused by a seizure, the Novo Go will automatically alert the operator and provide the location so help can be sought. When at home, an epilepsy sensor can actually be added to the Novo Go, so it continues to support the person whilst in bed. That's my 10-minute mark. The Novo Go can be used standalone, or it can be combined with a dock or even your current Legrand Care digital alarm, providing support for all scenarios. And lastly, if we can support a person to be mobile and active as safely as possible, both inside and outside the home, then this prevents health issues that occur through immobility and social isolation, and thus the pressures on the health service. Providing independence to a person living with dementia is also key to living the fullest and most empowering life a person can have. At Legrand Care, we believe that we are stronger together. So please contact me if you have any questions, or if you'd like me to pop and see you or do a demo, or even if you want to trial the Novo Go for free. Partnership working is key, and working closely with all my customers is an absolute must. And that is a strength that we can all share together and coming together and working together. So thank you so much for listening today. If you've got any questions, and obviously fire them at Jerry. So thank you.
Thank you, Cathy. Thank you very much. Okay. As I said earlier, thank you for keeping to time. Brilliant, everyone. If I could ask the rest of the presenters to please switch on their videos and mics again. Great. So we actually, in as part of the registration, give the delegates an opportunity to send some questions in. So we've got a number of questions. So I don't know how many we'll be able to cover today, but we'll try and cover as many as possible. And what I'll do is I'll ask the question to one of the panelists, but feel free to chip in once that's been answered. And I'm happy to listen to everyone's, and I'm sure the delegates are as well. So the first question we have is, how do you see the future of tech sector following the analog to digital switchover deadline after January 2027? I'll start with Sarah, if that's all right.
Yeah, of course, Jerry. Yeah, I think the analog to digital transition is a really important milestone, but it's not a destination. And I think in most cases, all we've done is move from an analog device to a digital solution, often SIM-based, which has created new operational risks, testing requirements, which I'm sure we're all still navigating through, as I know we are as a response centre. But I think where the real opportunity is for this is where we can look beyond the reactive response and towards preventative, proactive solutions. And I really do believe if we can reach people before they come to the front door of health and social care, we can really reduce the pressures on the services. And that's where I see the real opportunity, and joining up an approach that really helps, keep people in their own homes, but also avoid unnecessary cost.
Do you see a challenge in how prepared organisations are, which will restrict them from looking forward to the opportunities that digital brings?
No, I don't see. I think from what I've seen up and down, the country, people are really trying to do innovative things all over the place. I think where the issue comes is getting it from pilot stage to mainstream. So how can you really showcase that it's worth investing, because budgets are tight, and I think what I see is that you're trying to cope with what you've got at the minute. To reinvest in something that's not currently in your on your front door is really difficult, but it's about trying to get these pilots to actually commission care. That's where I see the challenge most. Thank
you. Anyone else?
Yeah, just quickly to add on to that as well, I think obviously the analog to digital switchover, we've got to be careful that we're not just replacing an analog button and box for a digital button and box, and look at what is out there and what's available. I think it's really important to make sure that we embrace the data, the analytics that we have got out there, to be able to look at some of these advantages of digital, so we can look at that the data that it's bringing and make a difference moving forward. And it's more of a proactive and preventative approach. Being able to move to remotely programming and all the benefits that digital can bring is really important. So where we have had challenges, and people have had challenges when it's become to finances, well, as we go back, past January 2027 and look to the future, we need to start embracing some of this new innovation that can actually be a game changer for the services and can transform the service as well.
Thank you. Thanks, Cathy. Okay, so next question is says, I work as a specialist learning disability housing occupational therapist, and I'm involved in building new and renovating older supported living schemes. I'm interested to know if the panel have found any affordable whole house systems rather than using standalone technology via the community care equipment contract. Maybe we could start with Shantelle on that.
Yes, thank you, and thank you for the question and the role that you do as well. Really important one. I would say that from our perspective, it's about enabling the sort of flexibility of choice, as I sort of talked about in my presentation. There are opportunity to have whole house schemes, as you touched on in your question, and then there's opportunities to support people on an individual basis, like us through Tunstall 365, and as others do the same. But one of the things that we're really working to deliver is a sort of hybrid approach that enables the two, so that organisations recognising that as well as the digital shift, we've also got the case that local authorities are needing to transition to a more self-pay model, because the existing models, we all know that telecare is not a statutory right. And so where funding has to be reduced, often local authorities will come to us and say, you're providing this service, we can't fund it anymore. And so we will support them through a transition from a funded model to a private pay model. And through that, I think in the context of this question, it's really important, because it's about having the flexibility to do either or both, and finding a solution that allows you to choose technologies that are right for the individual person and not a specific technology because that's what's in the contract. And it's a really fine balance to strike.
Absolutely. Thank you, Shantelle. So I'm going to put there's two questions that I think they sort of fit into each other. And they're both around GPS. So the first question is, what GPS technology is recommended for the use with clients with dementia diagnosis who are at risk of becoming lost? Who monitors the device once issued? And the other question, which is quite interesting really, is that do you believe that wristband GPS tele-alarms will eventually replace in-home installed hub units? I think we talked about that quite a lot with Legrand, Cathy, so maybe you'd like to start off on that.
Yeah, no problem at all. So just go back to which technologies are recommended from there. So every dementia diagnosis is different and it presents in different ways. So it's very important that the GPS solution is also adaptable for each person's needs. Making sure it's configurable remotely so you don't have to keep disturbing the person is always key. My dad lived with quite progressed dementia, so I had first-hand experience. Has also been a dementia champion for the Alzheimer's Society. So an example where for the Novo Go, for example, is used with a lady with progressed dementia. She likes to go outside, but she also has a heart condition. That means she's not able to be outside unassisted further than a garden gate. The Novo Go is worn around her wrist. She's got a little dementia lock on the strap, and she also has door contacts on her front door. So when she opens the door to go outside, it initiates a call on the Novo Go straight away. And as she's walking down the garden path to a gate, an operator can speak to the lady, even though she's outside and she's walking down a garden path, and just gently and encouraging her to not actually open the gate or be talking to her as she is. So the lady can be fully tracked if she goes further, and even a geofence can be set if she does go out there. But just the most important one on that, and just make sure it is configurable completely remotely. Just on to, do I believe wrist-worn GPS telegears will eventually replace in-home installed units? GPS devices have paved the way for independence both outdoors and indoors. And there will always be a need for technology designed for inside a property, especially when there is a requirement for environmental sensors like your floods, your COs, etc. But GPS can work alongside a digital home unit. when in the case of a Legrand unit, the NovoGo can be paired to the actual unit as well as being used on its own, and it can provide even additional support for home and away features, find me features, etc., whilst also protecting the property should the person be outdoors. So what it means is that when a person doesn't want any telecare in the property, then a GPS device would replace that one for them, and that would be a perfect option, thus enabling an all-age approach for telecare. So in a nutshell, GPS will become a big part of the tech offer moving forward, but it's not going to be a replacement, it's going to be an enhancement and work together with that. So yes, Joe, I hope that answers those two questions for you.
I think we've covered that quite comprehensively. Thank you very much, Cathy. Thank you. Okay, so next question. Interoperability across the system and multi-vendor landscape feels at times impossible with the limited funding. Complex architecture and legacy systems. How should this be approached and delivered to ensure the right data is available at the right time to the right individual? Would the patient becoming the data controller help? I think there's a lot of discussion with this, with the reorganisation of NHS and a lot of funding being directed at patient records and ownership of those patient records, which is we've been talking about for seems a long time, but only now seems to see lots of people nodding. This has been a frustration, I think, for me and many people in the industry. So let me start off with Robert. Robert, what's your thoughts on that?
Yeah, thanks, Jerry. I mean, the interoperability is a challenge. There's no denying that, and you've got two facets to that. You've got interoperability into an ARC where an alert can come into an existing platform, and we all know there are some challenges around that with regard to open APIs and the speed of which new technology comes in. And then you've got the other facet where from our point of view, where we've got our care technologists reviewing data, you've got data sitting on our alarm receiving platform, and then you've got various different web browsers open which collate the data and move them in. I mean, the one thing I would say is that the newer technology partners that we brought on board are a lot more flexible in allowing their product to integrate and allowing the data to flow. So, for example, we're able to track alerts. So an example would be if someone has a falls alarm or a pendant alarm, a traditional piece of telecare, but they've also got a medication box or a medication dispensing, medication adherence robot or something like that, we can track the individual has missed their medication. We can track then if that over time retrospectively will cause them to have falls or require hospital admissions. So therefore we can see if there's a reduction in their movement based upon the medication and act quicker on that preventative piece. Similarly, we can use the smart light bulbs to monitor their activity during the day as opposed to at night, as well as enjoying the circadian rhythm, which will then we can use the data to prove that that person then has less episodes of crisis. So whilst at the moment it's not perfect, I think we will move towards the ability to have the data lakes where everything all comes into one and flows backwards and forwards. There we will be able to do that, and I don't think that is going to be a massive, bearing in mind the cost across the whole of like the neighborhood health cost, neighborhood health transitions. That's going to be a drop in the ocean compared to that.
Thank you. Anyone else any thoughts on that before we move to the next question? Next question is, how do you see virtual support working for end-of-life patients? Maybe Stuart, you'd like to pick up on that?
Yeah, thanks, Jerry. I think, as in Charlie's story that I told you in my presentation, I think virtual support can play a really important part in somebody's sort of end-of-life arrangements, allowing them to return home and live with dignity in their final days. I think as it progresses and we get more, and based on sort of Robert's answer there really is interoperability, as we're able to combine more health data with social and environmental data, actually it becomes an important part of being able to really kind of manage someone's journey as well. So we're able to maybe intervene before a crisis point, and again adjust medication, or really kind of step in before that crisis occurs, and maybe avoiding that emergency 999 situation. So I think, yeah, it will get more and more proportionate and targeted to someone. But the key area for me is really allowing someone to spend those final days living where they choose, with a wraparound support. Never replacing the physical, but actually complementing and combining with it.
And I think probably follows on from that question is, how do we ensure digital inclusion so the most vulnerable people aren't left behind? I think that's, maybe you can follow up on that, Stuart, from there.
Yeah, I think it's really important. Again, it comes down to co-production of services from their side, understanding where technology in itself shouldn't be a barrier, because that should operate seamlessly behind somebody's support, and not sort of potentially prevent somebody from receiving care. But I think if we're looking at how we co-produce our services, understanding what people's needs are, and actually how technology can intervene with somebody. And then we work a lot in Mole Valley with a wide range of voluntary services as well around digital education. So in our social centres, people can attend and be informed and educated on how to use certain devices if that's a barrier. Or again, looking at some of those wider determinants of health, is digital poverty a potential barrier? And again, then we're asking our commissioners to think about the way they actually commission care, and actually, is there a wider level of support maybe around broadband connectivity, or that kind of SIM inclusion into packages of care for people as well.
Thank you. Nicola, this must be very much around your area as well of and the Maya product in terms of digital inclusion. How do you see the future?
Well, what we're seeing is, there is certainly a cohort of people who are sort of 75 and over, and in the areas of deprivation and that kind of thing, there is this digital divide, if you like. The Myra hospital discharge app we've enabled it to be used by the supporters of that person, whoever they may be. So if the person can't use digital technology, or hasn't got reach to digital technology, somebody close by them can support them that way. But the age groups of underneath that, I think it's changing really fast, as we can all see. You go and sit on a train or a bus or anything these days, and almost everybody, whatever, who has got a mobile phone in their hands. So it is changing. It is changing quickly, but it is still there, and it's really important. It has been important for us in our research to include, a cross section of the population, so that we can support as many people as possible.
Thank you, Nicola. The next question is an interesting one. It's quite wide, so. The question is, what do you think the tech sector needs more of? So, Sarah, maybe you'd like to?
Thanks, Jerry. Yeah, that's a big, bold question, that one. So I think if I talk from my perspective, I think, I've been over 20 years in the industry now, and I think the tech sector needs more integration, share ambition. And I think what I've been seeing recently is there's so much good stuff going on with AI, digital assessments, predictive insight, and remote monitoring. But many of these tools are still operating in silo. And I think if we can somehow work together, even with our own, when you see with local authorities, with other departments, if we look at the care assessments, that we're using, you're seeing the use of magic notes and these tools being used. for me, it would be really good to see how we can then use these tools to automatically then prompt tech assessments, and then vice versa when tech data. So we have all this data coming into our control center, and we see these changes in trend, button presses, falls, and how then we can then prompt back this can automatically then be pushed back to say that this is happening, this is a change here, we need to act and try and support this individual, maybe a change in care plan or even technology. So I think the collaboration bit, and I think it'll be really good, there's so much going on up and down the country. It's about sharing what's worked, what hasn't worked, and how people have come about the different barriers that they face. So bringing it all together, so when people are changing in their own roles and their own responsibilities, they have some insight. Yeah, because a big question. That was just from my point of view.
Are there areas that we, as a membership organisation and as that platform, can be looking at to assess that in the future, do you think?
Yeah, I do. I think actually providing real life stories of the people at the coal face, as I call it, the people that are there, in people's homes, and where people have done things that are differently, and showcasing those through, case studies and sharing those successes. I think that's something that would go down really well and support people that I know.
I see Ross making the notes there. Thank you.
Well, I've also noticed that Shantelle and Nicola have got their hands up for comments on this. Shantelle, can we come to you first for your input?
I think Nicola, I take that. I don't want to interrupt Nicola. I think your hand was up first. If you want to go, I don't want to step in front of you. You were first in the queue.
Thank you, Shantelle. Yeah, it was just to follow on from that I fully support, and I absolutely believe that the way forwards is collaboration. And it's very bewildering. We interface, directly with our focus groups, with our work with the public, and as I've said I think when I gave the presentation, that that people do feel overwhelmed and bewildered and etc. And what we're doing with the Mara app is we're enabling information to be clearly and give guidance, etc. And I do think that's essential, but as well, because it is a bewildering array of technology and everything that surrounds it for the users of it, or the end users of it. So yes, but I absolutely fully support the collaboration, and very happy to work with UKTelehealthcare to try to facilitate that somehow moving forwards.
If I could just round that off, if that's all right, just come in. I would say that from our perspective, what the industry doesn't necessarily need more of is more technologies. What I would say is just to kind of support what the other two have said, really, is that it is about that ability to integrate and speak to each other. And I know from a Tunstall perspective, our history has been variable in this space. And I think from our new leadership, if you haven't met Mark Hindle yet, our managing director, he's very much the first to say that it's absolutely critical to our industry that we do break down those barriers, we don't put up walls, and we enable interoperability with our competitors, our friends, shall we say, across the industry, and that's really, really important. But if you look at, I think it's also important to just take stock of what the sector has achieved. The NHS is still trying to get this right, and ultimately that's one overarching organisation. Yes, they support the whole country and they have various different trusts, but as a publicly run organisation that sits under one banner, they are still struggling to get this right. And we've seen huge waves in more recent years. But at some point, and I think Mark, our MD, talked about this at a conference earlier this year, but at some point when the health system does come to us with their social care interoperability platform, we need to be ready as an industry. And I think to do that, it's about recognizing that, yes, we are competing in, you know, for tenders in the day, but on an evening and on a, you know, around that competition, how do we work together more collaboratively to recognize that we are going to hold the sector back if we do not enable those barriers to be broken down?
I think completely agree with you, Shantelle, and it's always been the philosophy of UK Telehealthcare to look at that collaboration. I remember 20 odd years ago when I started off in this industry, to get the suppliers at that time to sit in the same room, we had to actually let one supplier finish a presentation before the other would come in the room. That was the sort of thing we were working at. Now we walk away from each event with at least someone telling me from coming out from there, we found something we could do with one of the other organisations. And I think that's always been something that's been very precious to us, that we can create that collaboration as an organisation. So absolutely 100% agree with everyone on that. Thank you. So next question. How important is it to address social isolation and loneliness through tech, and how is this being done? Cathy, maybe.
Yes, it follows on quite nicely from the last two questions, to be fair, Jerry. We have social isolation. It is a very important issue, and it can be supported through text. We know ourselves how we feel when we've got a quiet week, or we're in, or we're not very well and we can't go out. Being in the great outdoors and being amongst people is vitally important for your mental health. An example of where a Novo Go is being used at the moment is with a 64-year-old gentleman that lives with anxiety. That's been brought on and made worse by a recent bereavement. He stopped going to his usual shopping trips and in his dinner and Domino's group, and he became very depressed. He was then referred to GP for medication, but the medication didn't suit him and made him worse and made his situation difficult. Fortunately, a family member recommended him to the telecare service, and they've provided a Novo Go GPS telecare device, and this has supported him in reconnecting with his group, being able to be independent and having the confidence to go back out. Loneliness can bring about physical health issues and indeed add to the growing NHS pressures. And there's that saying that I always used to say, how you think is how you feel. So it's really important that we address the social isolation and loneliness and use tech to be able to do that if it can. Yeah.
Thank you. Thank you, Cathy. So next question. Can the panel elaborate on the key standard frameworks guiding technologies for supporting health and living at home? I think this is a question that has been around for a long time, and there have been different approaches to it, but have we had that support that has been national, governmental, and all those other things that we need to see adopted? I think with the mixture of your background and experience, Shantelle, maybe you'd like to kick off on that one.
Yeah, I touched on it a little bit in my presentation, but when I was in the digitising social care team, the level of support government should have in this in the sector as a whole, in social care as a whole, is always, you know, an ongoing question of what's the right level of support and where do we step in and where do we recognise that we're not the experts here. And I think, you know, I saw myself in the digitising social care team that we funded a particular technology, which was a digital social care record. But as I said earlier, beyond a care plan, the technology then needs to be really person-centred. And so we started the Adult Social Care Technology Fund, which I led, and that enabled regions to implement the technologies that they felt would be of best benefit. Now, that needs, at the minute, the way that operated, that was on a regional basis, that wasn't on an individual basis. So what I've been really, really pleased to see in more recent months is the government, along with NHS England, looking at that evidence standards framework, because that for me feels like a really positive way that the government can support us and enable the sector to move on. We know that across the sector there's various different iterations of standards. Myself previously in the TSA, we have the tech quality, technology standards. You've also got ORCA that look particularly focused on the use of AI and health technologies. And I think all of those frameworks and systems have absolutely, you know, all got a place to be able to support our sector. And I think what's going to be really interesting for me and for us as an industry over the coming months and year is to think about how do all of those come together with the support of government and that evidence standards framework. So I think it's going to be a really interesting time. There's going to be big questions about that, how that might impact commissioning and commissioning models. But I think from a commissioning perspective, from my experience, lots of people within those roles, you know, you're in that role because you want to support people in social care. And there are challenges around the kind of understanding of the technology and the complexity of how the technology actually works. And for me, any framework or any guidance that helps people who are there to support people to understand the complexity of the environment that we are now in with the advances in technology can only be a good thing.
Thank you. I think it's I found this quite interesting looking at this question this morning and thinking about the recent changes in government and the potential for Andy Burnham being the next Prime Minister, and thinking back to 2010 when Andy Burnham, then the young Health Minister, together with Gordon Brown, attended Newham when I was working there, to find out how things were going in the whole system demonstrator. So I hope Mr. Burnham remembers a little bit about 20 odd years ago and what we tried to tell him in Newham about the text industry when he comes to power, if he comes to power.
Absolutely. And I think the thing is as well about government to sort of to remember, and it can be quite easy to forget sometimes, is they were the Department of Health until fairly recently. I think it was 2009, if I remember rightly off the top of my head, when social care was integrated. And on the inside, you know, there's still lots of talk about, you know, patient-led conversations and the NHS, and it's a really difficult challenge for us to sort of fly the flag of social care when you're in a, you know, you'll sit within the Department of Health and Social Care that has the entity that has the NHS to support at the same time. And having those ministers that really actually understand social care, that was one of my favourite things, was to accompany ministers into care homes and help them really understand what it looks like.
Absolutely. Okay. So final question is really around those local government layers. And the question is, what impact do you expect the local government reorganisation to have upon citizens reliant upon local authority service delivery? I think you're very much on the ground there, Stuart, to pick that one up.
Yes, yeah, very much living and breathing it as we speak. And I think initially, you know, the impact that we need to ensure. So we're obviously in this at the moment until the 1st of April, when we will transition into 2 new authorities, is that we deliver a safe and legal service. And that's very much the terminology that we're using. So it's really ensuring that our residents do not feel any change as we transition into those new county or new unitary organisations. And when I think about it, though, I think there's a real opportunity here, because it is it's a real fundamental change for us to lose that 2-tier approach. I think from a resident point of view, it will be much more streamlined. So there is a single point of access to where they need to kind of find their services. So we're no longer split from that aspect. But I also think, and I think what we're finding, for the commissioners to revalue and relook at what the local service provision is, because there are some fantastic tech services in district and boroughs. And so it's actually asking the question, well, how do we use this brilliant resource differently? What can we do to reshape that form? So actually combining that again with our neighbourhood structures and looking at that local level support, that we can really start to redesign those frontline services, combining with social care, combining with our health partners, combining with a voluntary organisation, to really start to deliver some key benefits. And what the future looks like, we don't know. What that structure will actually kind of take place is still very much unknown. But I do think that there's an opportunity to redesign and reshape what we're doing, but really basing it in the heart of that in West Surrey and East Surrey. So I hope that's kind of sort of a lead for other organisations, other counties and other district and boroughs that are looking at that reorganisation to first of all map out what you have and make sure you're really utilising that.
Thank you very much, Stuart. No, I think that's very timely end to the panel session. I'd like to really thank all of you, Cathy, Stuart, Robert, Nicola, Sarah, and Shantelle, for joining us today, giving your time, giving your input, and also the real message, I think, is what we talked about a little earlier, is that we're all pulling in the same direction. I felt today was a real partnership presentation, which, as you know, I come to the end of my role really in this industry. But you never really move away, because I'll come back as an expert user because I'm getting to that right age now. But thank you very much, and I'm sure that the delegates really appreciated your input as well. I judge these things from how many delegates stay the course, and we had over 75% of delegates from the beginning stay on till the end. So I really appreciate that. Also, thank you to Rebecca for her production role in the background. I think you'll be seeing more of her in the front of the camera in future. And really, I'd like to maybe hand over to Ross to wrap up his thoughts on UK telehealthcare and going forward.
Yes, everybody. Oh, hang on a second. Yeah, no, thanks for everybody in attendance. Technical issues, the camera's frozen, so apologies for that. I hope you can hear me. Thumbs up would be good. Cathy, I see you first. Yeah, can you hear me okay?
I can hear you.
Perfect, good. Yeah, no, really, obviously, this is I'm going to say a learning experience curve. And I'll go back to what I said at the start with Jerry, and thanking him for the support over the past few months with this. This was just to get a feel of how these events are run from behind the camera, as opposed to sitting admiring. And again, picked up a lot of experience today that going forward, I'm sure that we will be delivering regular events over once we get over the holiday season. Myself and Rebecca and the wider team have already got a wider timetable of events that are different, that assessing and reflecting what's required in the sector. That index and menu will be out pretty soon. We have got a brand new website, hopefully going live by the end of the week. That there'll be, no offence to what we've currently got, but a much more modern platform that looks and fits the needs that we've got, much more interactive with clients. And again, all the members will be reaching out to them to give them their starter package, shall we say, and guidance on how to use it. And something that's been touched on quite a lot through this was the whole the joined up approach. And it isn't just in the tech side of the care sector, it's across the care sector as a whole, that there needs to be a more joined up approach between service, delivery, partners, and just the way that this is being to use the word managed. It can be so much better and so much smoother, and collaboration goes a long way to make that what I class as the perfect model in my head. So, but again, that just following on from Jerry, thanks to everyone for coming on. I appreciate the time. We'll get this up online hopefully by the end of the week, once we do what we need to do to it. And again, just thanks to everybody. Much appreciated.
Thank you very much. Thanks, Rebecca. Bye.
Thank you. Bye.
But thanks, everyone. Bye-bye.